Hi everyone, and welcome to the Mental Health Family Hour. This is more or less our year anniversary, so thank you very much for the support over the last 12 months. We really appreciate it. So if you are new to this webinar series, my name is Sam Tyrer. I'm the Prevention and Engagement Lead at Lancashire and South Cumbria Foundation Trust. I'm also the founder of an educational service called Change Talks, which basically aims to prevent ill health. And I'm also the co-host of this show. Dave.
Hi, I'm Dave Cottrell, aka Mindset by Dave. That is genuinely what my mum called me. It's on my passport and everything. I am a mental health educator and a person who lives with mental health himself, having type 2 bipolar disorder. So I come at things from an educational and a personal perspective point of view, with the aim to try and help demystify mental health a little bit and make it a little bit easier for everybody to understand. Today, I will mostly be running the chat and things though, and so if anyone does have any questions and stuff, pop them in the chat and I'll be keeping an eye on all of that.
So you've said this for the last 3 weeks and you don't understand monitoring the chart. You do contribute a lot, so none of that. So so any questions, as David said, just please pop them in the chat and we'll answer them at the end. If you do want to get in touch following this webinar, then please do email me on sam.tyrer, so that's Tyrer, at lscft.nhs.uk. So welcome to our lovely 3 guests today who have joined us from Minds Matter. So we're going to be touching on treatment for mental health issues today, and that's not going to be all treatment. We'll come into what they're going to be talking about shortly, but I'm going to ask them to introduce themselves. So I'll just go across my screen and we'll start with Paul.
Hi everyone, my name's Paul. I'm a CBT therapist, cognitive behavioural therapist based in Chorley and South Ribble, and I work for Minds Matter.
Perfect. Charlotte?
Hi, I'm a PWP, or a psychological wellbeing practitioner. We're called PWPs for short. I'm usually in the Preston team. I supervise other PWPs within the team.
Emma?
Hi, I'm Emma. I'm a counsellor with the Blackburn with Darwin Minds Matter team.
Perfect. So I think the question that we'll start with is, what exactly is Minds Matter? And any one of you can start with that.
So Minds Matter is Lancashire and South Cumbria Foundation Trust's IAPT service. So an IAPT service is sort of a national programme across all of the UK, and it stands for Improving Access to Psychological Therapies. So these sorts of therapy services are set up all over, and they've been around since about 2007-ish, and it's basically a service that provides psychological talking therapy support to the general public for sort of things like stress, anxiety, depression, and it was sort of set up really to look at, because there was really long waiting lists for treatment, and now this is sort of a national program that's rolled out, and it's really quite successful in lots of different ways.
And does that tend to be more low-level mental health struggles?
I think we're commissioned for mild to moderate.
Mild to moderate.
Mild
Right.
anxiety, stress, and depression.
And just because we do have people watching normally throughout the UK, is it called Minds Matter in other counties, or is that just Lancashire?
No, that's Lancashire, South Cumbria, although the South Cumbria bit, I can't remember the name, but they've got another name, so that's just in our area.
Right, perfect. So to start with then, you've all mentioned your job roles there, so I'd really like to get an understanding of exactly what you do within your job role. So I'll start with Charlotte, as you were the first one to answer that question. So what exactly is a psychological wellbeing practitioner, and what therapies do you offer?
Okay, so we do a whole bunch of stuff. So we do more of the sort of low intensity support for people. So we see the most amount of people with a variety of different things. So we're all qualified clinicians. We sort of do a year of study and practice. And what we offer is sort of a low intensity version of CBT, which is what Paul provides. So we do things like it's guided self-help, really. So we sort of give support and guidance on different coping strategies for stress, anxiety, and depression. So we do things like educating people about panic attacks, what happens to your body when you're panicking, because I know I wasn't taught any of this stuff at school. So we sort of explain why your heart's beating really fast and why you feel sweaty and you need the loo, and sort of go through the function of all these different things to sort of help people understand what's happening. We also do things like worry management. So sort of helping people maybe rationalize their worries and make it so that you're not worrying all the time. So there's different techniques for that. We look at thought challenging, so sort of all the different upsetting thoughts that people might get. And we do things as well, like trying to face your fears very gradually, so that you know, some people can't leave the house, or they can't go to the shops, or they can only go at a certain time of day to the supermarket, things like that. So we help people sort of build their confidence with those sorts of things. We also look at sort of practical problem solving, sleep difficulties, and a big thing that we do actually is looking at people's motivation. So building, because a lot of the time, especially when you're feeling really low, you just think, I can't be bothered, I don't want to do these things, and we sort of lose the activities we used to do day to day. It might be the things that you're interested in, or it might be you know, stuff that you have to do. So building your motivation for that, and we offer those sort of coping strategies in a variety of different ways that I can go into now in a little bit.
What age range is it? Sorry, Charlotte, as well.
Oh.
Is it different for all your services, or is it sort of a universal?
16 plus. So
right.
16 onwards, we're an adult service, but we do take 16 and 17-year-olds as well.
What I'll do is I will come back to some of the techniques that you mentioned, because I would like to know more. First of all, I'll just try to understand what everyone else is offering, especially around panic attacks, because that's something that a lot of young people in particular that I've been dealing with have been presenting with throughout this last 12 months. So because you mentioned CBT, Paul, I'll come to you now. Could you explain to us what CBT is, please, and what that therapy looks like?
Yeah, cognitive behavioural therapy looks at how we think, how we act, how we behave, how we feel, and how we react physically, and how they all link together and interact with each other. So if you think scared, you act scared, you're going to feel scared. If you look at how to change one of those things, and we can change how we think, we can change how we act, it will have an effect on how you feel and how you physically react. And we also look at how to react to that reaction, if you will, if that makes sense. And we try to get people to be more accepting and tolerant of how they feel, rather than trying to not feel, because we're human beings at the end of the day and we all feel. So if we don't have a fear of being scared, we won't be scared as often, and we can shift it quicker. And we also teach you how to do those things. So it's sort of an extension of a PWP. If we look at a stepped care model, I don't know if people know what that is. It's basically step 0 is where you're all right, step 5 is inpatient. We're at step 3. Charlotte will be at step 2. So we see the people that are maybe needed more help, or that they've been to see a PWP and it didn't quite work. So we see them for longer. And we also look at more specific things like post-traumatic stress disorder, health anxiety. So some of the things that they might not do at PWP level, you would see a CBT therapist.
So would then, if an individual is referred to Minds Matter, would they always go through Charlotte's role before coming to CBT, or can someone go directly into CBT?
Yeah, it depends. When somebody refers in, we call them and we ask them what they want help with. We also ask them to have a think about what we're trying to aim for, what successful treatment would look like. So what sort of things would you be doing if you were okay? And then we decide then with the person, which one do we think is the best level to go into? If we can see people at the lowest intensity level, we will do that. But obviously some people we know are probably going to need a CBT therapist anyway. Yeah. And some of the things like I said before, post-traumatic stress disorder, I don't think PWP would help people with that sort of thing, they would need to see a therapist straight away. You know, they don't necessarily go through PWP, but we would talk through it with the person as when they referred in. And as Emma will probably tell you as well, you know, we also discuss counselling and all the groups that we do as well at that stage to see what we think and what they think is the best option.
And do you say, right, we're going to offer you 6 weeks of CBT or 12 weeks of CBT, or is it just an ongoing process?
Yeah, no, there is a limit to it. That's one of the big things with Minds Matter and all IAPT services. It is a time limited thing. Generally for CBT, we would have 6 sessions to see how it's going, and then we can have up to another 6 sessions. But if there's a clinical need, then we can extend that. PWP, I think, is 6 half-hour sessions. I think counselling is 8 sessions, but Emma will let you know on that. So it isn't set in stone, but we are time limited, and that's one of the reasons why we need to know where people are going to. But what I would say is it's not our job to get people better. We help people to help themselves to get better.
Yeah.
Hopefully, what we teach them to do is to become their own therapist, so that they've got the techniques that they need. And if they carry on doing it, they will improve their mental health. And hopefully, life still happens. Hopefully, if something happens, they know what to do next time.
Mm-hmm. Yeah. So you, while someone is having CBT, they can get other therapies as well, such as what Emma offers, which we'll come on to in a second.
You wouldn't do it at the same time,
right?
Because it can interfere. So, but again, we would discuss that. It's not recommended. To do that, and nice guidelines say that as well.
Perfect, thanks, Paul. So Emma, we've briefly mentioned you a couple of times there, so could you tell us all about counselling, please? That'd be absolutely fantastic.
Yeah, sure. So counselling is quite different to both the PWP and the CBT in that it's much less structured in the way that we approach the session. So we would basically have a chat with the person that's coming in to counselling. So we work with people who've experienced a range of different problems. That could be anything, say, from feelings of depression and anxiety, bereavement, any loss, any past experiences, you know, from throughout their lives. And we give them the space then to process that in the present moment. So we don't sort of look at a structured way of doing that. It's more allowing the client the space to talk at their own pace, to process how they're feeling and how that's, as I say, impacting now and their feelings around that in this moment.
It sounds like everyone would benefit from this in a way, from a bit of counselling. We could all, but do you find that there's a lot of stigma attached to people reaching out for counselling?
I think there used to be, more historically. I think, thankfully, you know, with the way in which our generation sort of promoting things now and different sort of platforms such as Dave's, you know, different audiences are being reached, and it's been normalised a lot more now that our mental health is just as important as our physical health.
Yeah. So in terms of time then, Paul mentioned it briefly. What's the timescale of someone receiving counselling through Minds Matter? Is that over 8 weeks? I think Paul said 8 sessions, did he?
8 sessions, yeah. So we initially offer 8 sessions of counselling. As Paul said, you know, Minds Matter do only offer brief time limited counselling across any of the formats. But also, as Paul said, you know, we can look at a small extension depending on how the work's going with that person and what feels best between sort of us and the client.
Yeah. So if, for example, in any of your therapies, when they've got to the end of these sessions and it feels like it's not going anywhere, what's the next point of call? I understand that you may be able to extend it, but if you've basically found that it isn't helping that individual, what's next?
I think I just need to say as well, if we sort of think that it's not working, I think we would bring it up before the end of the 12 sessions or the end of we would be saying to the patient, client, call them what we want, that, you know, it's not working. What do you think that is all about? And we would talk through it. And it would depend on then what's going on. CBT counselling doesn't work for everybody. It's like anything, you know, if you go to the gym, some people get really fit and healthy, other people don't. So we would talk through. There are other options within LSCFT for mental health, but sometimes it's not the right time, So again, people can go away, have a think about it, come back. And also as well, this is learning a new skill. So sometimes it might not appear like anything's going on, but actually it's in there. And, a person might sort of feel the difference later on, if you will. Within Minds Matter, there isn't anything other than what we've said as well.
Yeah.
There's our groups as well.
Yeah.
But like everything, it doesn't work for everybody. But we would have that discussion with that client, and you don't get one go either. I've had people that have come a couple of times, not really got anywhere. They've gone away, had a think about it, sorted a few other things out. They've come back to Minds Matter, and then it's made a difference. So again, it would always be continuous discussions with the client.
What do you mean by our group? Sorry.
Well, we also have groups within Minds Matter service, so things like stress control is a PWP group where there's 20, 30 people in the room, and they would do the same as a PWP would do, but to a group.
And it's a non-interactive one, so people don't. Yeah. It's really good for people who maybe don't know what they're after, but want to learn maybe why they're feeling, how they're feeling and stuff. So it's a non-interactive course where you can just sit and listen and learn. And then we've got interactive ones like the Wellbeing Workshop, where it's smaller and it's not group therapy. You're not asked to share your childhood and why you're there and things like that. But you talk about how are you finding this technique, and let's talk about how we can practice this. So it's quite a supportive little course. So we run different ones for different things. We've got like an understanding trauma course. We've got a new coping with lockdown course that we're setting up, one for sort of how to be me again, which is for long-term conditions. And there's a CBT one at step 3 that's overcome your fears. So there's lots of different courses that are quite good. But going back to your question about what do you do if it's not right, or if the sessions aren't working, there are quite a few different options within our service to choose from. And like Paul said, we would review probably earlier on, and we all receive supervision, so we'd sort of seek support from our supervisors to sort of say, oh, this person is struggling, but so we'd always be able to feedback so we can give that person the best possible support that we can. And sometimes it is about timing, or are they like Paul was saying, is this the right time for them? Are they commit to the sessions? Me and Paul especially will be giving people things to try out in between sessions, and do they actually have time to give this a go? Are they trying it? And you've got to explore what's not working, so that you've always got that opportunity, and thinking about what their goals are, and are they fitting with the type of treatment that we're offering? Have those goals changed?
And how do people refer to yourselves?
Oh, well, we're self-referral, so people can self-refer to us through the Trust website, so I can give you those links afterwards. People can also just phone their local team, because we actually cover all of Lancashire. We've got 11 different teams. So the 3 of us are all from different teams. So yeah, you can go on the website, phone us up. You can go through your GP, but it might take a bit longer, obviously, because you've got to get to your GP and wait for the referral to come through. So that's the main way.
Yep.
People may have been through other services as well, and we request, if they're under another mental health service but think a referral to ourselves might be useful, we just ask that their sort of practitioner will send a professional referral in, just so we can get some more information and make sure we're going to be the right service for them, most beneficial.
So when someone does self-refer, does that also go to their GP as well?
No.
No. So when sorry, I'm just asking questions that are coming to my mind here. So an individual self-refers, you then assign them to a certain style of therapy that you think is appropriate for that individual. That therapy or the other therapies, they're just not working for them. So at what point then do you have to get the GP involved if they need more? I don't know, how do I word it?
It would depend, again, some people that we see, it might be that there are other mental health problems or mental illness, that would mean that we would have to maybe refer them to psychiatrists, you know, if it's personality disorder, something like that, or, you know, it might be that there's other stuff that needs sorting out. So especially in Chorley, we're tied in with the Chorley Council. So if it's a housing problem that needs looking at, we will refer them to the housing team. If it's environmental, we can refer them to that. That's just in Chorley, I think, and South Ribble. But again, we would be looking to, is there any other organisation, any other body that can help you to sort out this thing that's causing the problems? We wouldn't necessarily make a referral. We would, you know, maybe ask the person to do that. But again, you know, it's not, this is it. You know, I need to stress that sometimes it doesn't work because it's not the right time, and that might be for whatever reason. We would talk about that and say what we think it is, and ask the person what they think it is. And sometimes it's just, you know, you're not ready to commit to therapy. You haven't got time to do it. So go away, have to think about it, and come back. If people are a risk, we would never leave them. Nothing. But it wouldn't be a service that would help them with that.
And do you find that some people, when they do attend therapy, so Emma, for example, when someone does attend counselling for the first time, that they're quite reluctant to open up? Because I found that, so I've had counselling through this job role to ensure that I'm offloading things that I've come across. And I have to be honest, when I first meet a new individual, I'm reluctant to open up to them straight away. Does that take time to sort of break down those barriers?
It certainly can do, yeah, and I think that's very human, isn't it? You know, whenever we meet new people, especially when we're faced with the honest that this is therapy, so I've got to then tell this person all about myself and tell them how my deepest, darkest thoughts and how I've been feeling. It is daunting, but then part of therapy in any of our modalities, including counselling, is building that relationship with the person that we're working with and building that trust within that, so that the person then gradually does feel more comfortable and more able to talk to us in that open and honest way.
And sometimes, if that does take, sorry, go on, Charlotte.
I was going to say, sometimes it can be the opposite, where people are absolutely bursting at the seams to be able to tell someone because they've never had that person before. They don't feel they can talk to family and friends. So it can be either way.
Definitely, yeah.
I quite like doing that myself in my practices. At first, I just let people, if they want to go and get everything out. And just doing that can help. You know, if I've seen a few people where that's been the thing they needed, and we're almost there already. You know, it's just getting it out and not holding it in. And again, you know, it depends on the individual. Some people tell you everything straight away. Some people you've almost got to really get them to trust you before they do it. But there's no time limit on it. We're doing that, you know, apart from the time limit we have in therapy.
And if you found that they're sort of only opening up towards the end of the sessions, are you normally happy to extend that further or not?
Not the session, no, because we'd have someone else probably.
No, sorry, the amount of sessions. Sorry, I didn't word that right.
Case by case, really, doesn't it? It depends what, you know, where it's led to, and is it that actually they need a bit of time to think about and process what they've just talked about and then do something about it afterwards, or is it that actually, this has created another issue? So it's all sort of case by case.
We would also, as well, sometimes we tend to see people each week, but sometimes we leave a bit longer because of what Charlotte's just said, because we're obviously talking and reflecting on things all the time with the client. You know, if we say that, okay, maybe you're not sure, let's have 2 weeks in between and then come back, the time frame is extended, but the sessions remain the same. So again, we're not limited to 12 weeks, and that can help in therapy as well. You know, it's part of the process.
And step 2, the modality I work in, the sessions are normally every couple of weeks, so it gives you a chance to try stuff in between as well. So we can extend that a little bit more and things like that sometimes. It's all quite, it's case by case. We're not going to sort of make everyone have the exact same thing because people aren't all the same.
Exactly.
Dave, do you want to come in with any questions?
Just a couple of questions from chat, actually. The first one is, what are the wait times currently for these services?
I was going to ask that. That was going to be one of my other questions.
I'm surprised you didn't by now.
No, I can carry on, mate. So I'm trying to just shut up for a second.
It does vary team by team. So because there's 11 teams with different populations, different needs. So we can't give you like this exactly what it is because it's all, it's such a big service. But what tends to happen is that when people sort of say if they self-refer via the website, we might sort of screen their referral and then we'd offer them a telephone assessment, usually within a couple of weeks. Mm-hmm. And at that telephone assessment, we decide what sort of support you're after, what your goals are, what your needs are. And it depends on the options. So say at step 2, we've got Silvercloud, which is an online therapy program. For a lot of the time, you can access that from that day. So you're not waiting really any time. The groups are normally back to back all the time. So say if you've got the wellbeing workshop, it would just be whenever the next wellbeing workshop starts, which is normally within 6 weeks. But for step 2, the sort of the PWP one-to-ones, it does vary team to team, but it's usually couple of months, so it's not these really long waiting lists that you do hear about sometimes. So that's the sort of step 2 stuff.
And you just think, don't they, 9 months waiting time or something.
I was going to say for step 3 for CBT, generally the most we've had it in a couple of years is 6 months. That's 6 months. Most. It tends to be 3 months is the normal, I would say, in the Chorley team. But like Charlotte said, it depends on what you want and the groups and things like that. And we do also as well, there are, for example, if someone is perinatal, so that's from its conception to 1 year, I think it might be changing to 2 years of having a baby, and that's male and female. Obviously the males don't have a baby, but they've got the baby there. You are seen quicker. And also military veterans as well, if they're being affected by what's happened in their service, they will be seen quicker as well. And that's they'll probably get seen within, once they've had a telephone assessment, within 4 weeks of that.
Sorry, Dave, I interrupted you then as well.
That's okay. There's a couple of follow-on questions. I'll go them in the reverse order, though, because this one's more appropriate at this moment, which is, what do you ask patients to do whilst on waiting lists? Is there other support they can access?
Depending on what's going on for them. So we might send them out some information. There's like self-help websites that we can send people to just read up about their particular problem that they come in with. So they might want to read about anxiety or panic attacks, especially if you've got someone with panic attacks, you don't want them to wait too long. You might give them some information or send them to YouTube videos just to give them something. We can also send out local, all the teams have their own individual sort of who can help sheet, if you will, where it talks about the local other services. So there's like social inclusion services, peer group support, what their local sort of support numbers are, like the crisis teams or things like that. Or it might be that there's local men's groups that they can go to. So we try and signpost them to those. And there's also we signpost a lot of people to Togetherall, which is an online therapy service, but we offer everyone, they do like a big anonymous online forum where you can just talk about what's going on. They will not let you put details of who you are or where you're from, so you can't be identified. So a lot of people find it really nice just to share anonymously, just again to build up those support networks. Sometimes we might send people to drug and alcohol services to reduce their drinking and things like that. Or again, like Paul was saying, it might be housing. Let's look at some of the practical issues that when you come, it can focus on the sort of psychology side of stuff.
And there's also a great resource called the Mental Health Family Hour as well, which has got some loads of available free webinars, which teach you about positive coping strategies.
He tells me off for plugging things. Wait a minute, that way.
they're the sorts of things people should be looking at, because again, we're not going to cure anybody. Our job isn't to get people better,
Yeah.
And if people do want to be wondering what to do while they're on the waiting list, then honestly, things like this and some of the things Charlotte has said are the things that people would benefit from.
Because there's so many free resources out there, isn't there? There's things available to learn, and it's like you say, you have to really want to help yourself. I'm very open about the fact that I struggle with depression and anxiety, and I went through it for years where I didn't want to help myself, and it was only when I turned everything around was when I thought to myself, you have to do something. I'm in control of my own life in a sense, and I have to really want to help myself. And when when that clicked in my mind and did start to do things on a daily basis, that's when slowly but surely I went through my recovery, shall we say, which is always ongoing, I suppose.
That's a big thing, and again, we're not magic. We can't wave a magic wand. In order to improve your mental health, you've got to do something.
Yeah,
a lot of people are sort of they'll come to treatment and they'll listen to what we say in the session. So if we're seeing someone one-to-one or in one of the groups, they'll say, oh, this is brilliant, but they won't maybe try out the things in between, and that's sort of maybe a sign that maybe they're not quite ready to do this stuff. So it's all good talking about stuff, but unless you make any changes, you're probably not going to feel very differently. And sometimes it's like people are waiting till session 6 when we've got this magic sentence we're going to reveal, which will click, and it's not like that. It is sort of giving it a go and seeing what works. Not everything's going to work, but sort of committing to trying some of it out.
Because I suppose there is no quick fix in a sense, is there? It's it's kind of an ongoing process, and you can do daily things that can improve your well-being. So, but often I suppose when I was in sort of that really low state, I didn't really think like that. Anyway, I'm turning it on to me here. I don't want that. Dave, do you want to come in with anything else?
How is the online service working rather than face-to-face? Have you noticed any negative or positive impact?
I was asking these questions. You're pinching them from me.
That's cool.
I found quite a few positives from working sort of over the phone and working online. Just in that, it minimises attendance anxiety, if you will. So people feel more comfortable in attending their appointment because they don't have to come to a place that they don't know before. There is that anonymity as well in that we're working, if it's on the phone, it's not face-to-face, so they don't have to sit and look at us. It is very much that they can just talk and feel free in that.
How have you found that in the interactions, Emma? Did you find it challenging at first trying to talk via online platforms or not?
At first it was a bit strange because predominantly in counselling, we're trained how to not only hear people but also how to look at people's body language, how that changes when they say certain things. But I found that I never thought this would happen, but I've actually become more in tune as to people's voices, to the changes in their intonations. I can tell when they're almost tensing because I can hear that change in their voice. So it's actually, the work's got a lot deeper and it's actually been a lot more effective in a way since we have been working virtually.
Has that been the same for yourselves, Charlotte and Paul?
I think it requires quite a lot of concentration, especially at the beginning, because you don't have those visual cues to kind of think, oh, do they really mean that or what are they saying? And it is harder, especially as you're trying to sort of explain techniques, and we often use a lot of worksheets and things. So at the beginning, you're trying to abstractly kind of explain what this looks like. But we do have a really good platform now, Attend Anywhere, where you can screen share. And it's really, really helps show, so you can sort of show the client, this is the worksheet we're using, this is what we want you to do, and this is so they can see it, which really, really does help now. But I think, like Emma says, people do feel a bit anonymous sometimes over the phone. That some people really like that. Some people prefer face-to-face, but I think it means now that we can probably cater for more people because there is that option. It's forced us to have these options.
Yeah,
I've noticed, and quite a few people have said with social anxiety, for example, they probably wouldn't have turned up for the first assessment if they'd have had to come to see us face to face. But like Emma and Charlotte have both said, answering the phone is a lot easier than having to turn up somewhere and find where we are. And I think going forward, I think in the future we're going to be offering still video conferencing, still telephone and face-to-face, because we have found that it is very effective. I'll be honest as well, I didn't think it would be as effective, but I haven't found it to be any, I've surprised myself. We've probably adapted to it, but actually I quite like doing it. It's we're offering a good service with it as well.
How did you... Sorry, go on, Charlotte.
I was going to say, one thing to point out though is sometimes people get a little bit too lax with it, and they might be trying to do the therapy, while doing something else. So I think that can sometimes just be a bit of a barrier to engagement, really. So it's just explaining to people that you do need to concentrate and treat it as though most people do, but there's sometimes you do have to explain that you need to concentrate as though you are in person.
And how did all of you three sort of find it? Was you anxious about your first sort of Teams calls or Zoom calls?
Yeah, to be honest, it's human to be like that.
Yeah.
But if I'm honest, when I'm seeing a person for the first time anyway, I'm always a bit anxious, because we have I wonder what they look like, I wonder what they're going to tell me, I wonder what they're going to say. So we get anxious because we're human, it's normal to do that. So we did have anxiety, but like anything, the more you do it, the more you get used to it, the more you're okay with it,
And some of the different types of clinicians might have been working from home, doing, say, telephone assessments previously anyway. So some people had a little bit of experience working from home remotely before, but a lot of people, I think it was a bit of a mixed experience throughout the teams. But we all got to learn from each other. So the people who'd been doing it before, could prove that it does work. We were already doing it. So I think we were sort of already had our sort of foot halfway in the door already a little bit anyway.
And in a funny way, because we didn't have a choice. We had to do it.
And I think because clients didn't have a choice, they all got on board. Because I remember a couple of years ago, we did try and offer like Skype therapy. Yeah, and we initially had people go, "Oh yeah, that sounds good," but then it sort of fell away, and people shied away from it. When actually, because everyone didn't have a choice, people actually realised the benefits of it. But for some people.
And just to reflect then, we mentioned this before coming on air, the last 12 months, how has that been for your service? Because I think from an outsider's perspective, what people will be thinking is there will have been a huge increase in demand for services like yourselves. Is that what you've seen or not?
I think we've all been waiting for this big wave to hit. They kept talking about it on the news, didn't they? And I think referrals reduced a little bit, because I think people were just so busy trying to cope with, and it wasn't a case of, I need help with it. It was just a case of, I need to get on and do it. And I think that's what happens for people in general. If they've gone through something really difficult, often people just get their heads down, plow through it, and then it's only afterwards they kind of go, "Oh, I'm not actually that okay." And I think that's probably what we're seeing a little bit more of now, and people anxious to go back into, as much as we all can't wait, there's going to be a lot of anxiety about that. But we're still getting quite a lot of people through all the teams.
Yeah. I think we need to say as well that people don't have to be struggling. People don't have to be not functioning to come and see an IAPT service. Minds Matter. We can help. Like I think Sam said it before about everyone can do with counselling. We can help almost everybody. Whatever they want the help with. You don't have to be ill to come and see us. If you want to improve your mental health, then come and see us.
Would you say that's what puts people off, Paul? Do you think that people automatically think that I have to be unwell to receive these services, when actually it will be good to think about before people do have any issues whatsoever to try and keep on top of that? I
think it does do with blokes. Again, we see probably 3 to 1 female to male, and there might be a generational thing there as well. But there is something there of but I'm not ill. You don't have to be ill. If you don't wait until you're unhealthy and massively overweight to go to the gym. If you want help with your mental health, then come and see an IAPT service, listen to these podcasts. All those things are going to be very beneficial. And I think there is a little bit of that, if I'm honest, that people don't think they're ill enough to come and see us.
I completely agree. I'd say, we're all normal people, and what we're dealing with is, stress, anxiety, and low mood is all normal for all of us. And, we'll have all grown up. No one has told us how to deal with panic and feeling down and having upsetting thoughts. And we've basically, all of us have just made it up as we go along. None of us have really been told what to do. It's only recently in schools that this is happening. So some of the things that we will have taught ourselves will be helpful. Some of it won't be helpful. And it's just about trying to unravel, what can we do that's maybe a bit different? How can we maybe override some of the unhelpful sort of thinking or coping strategies with something that may be more helpful? And all of those things, they're all normal. And I think that's really what we want to get out and say to people, that just like Paul says, you don't have to be unwell. There's nothing wrong with you to come and see us. It's just about improving your life, getting the most out of stuff. And if some techniques can help you do that, or talking to someone can help you do that, then give it a go.
I saw Dave getting a bit itchy, so I've got a feeling that he wants to come in with something.
It's brief for a change.
I don't know. You've said this before.
I was just going to say that I think that the perception that you do need to be of a certain level before accessing services it's there, and it's quite founded as well. I mean, I've spoken to countless people who have, with mental health, self-referred to A&E, for example, and they've been told it's not as serious. People have been told, if you're not within immediate harm to yourself or others, then this isn't serious enough for us to handle it. And I think, unfortunately, that's kind of been taken on board as the NHS don't handle it. A&E won't handle it at this level. But I think people have then taken that rule and heard it as, well, we can't go unless it's too serious. And what Paul said before as well, I've experienced a lot of that with male clients, is the fact that they either think, they don't tend to come at in the middle. They come either at, well, this isn't a problem, I don't even know why I'm talking to you, my wife told me to come and speak to you, or they're all the way at the other end of it, which is everything's completely and utterly on top of them. But you don't tend to see much in the middle when it comes to male clients. But I do believe that we need to kind of put out there to people exactly what you've just said. It needs to be said and heard a million times, which is, you don't have to be terrible you don't have to be, it doesn't have to be bad enough. If it's bad for you, if you're having problems with it, that is bad enough. And these services can be accessed for that. And that's actually, it's not short, is it? It's my mission for this year, actually, Sam. I've just remembered that my mission for this year was to get people to treat their self-care like multivitamins and not like painkillers. Because painkillers you take once the pain is there. Multivitamins you take as an insurance policy. Now, I'm not saying go and use an IAPT service, if you've got no mental health problems whatsoever and you're just I'm just going to take it as a kind of insurance policy. But we do need to look at our health a little bit more like that, both physical and mental. It's okay, what can I do to improve my chances of not getting ill, rather than kind of, fighting the losing battle once you already are.
And that's why things like stress control, the wellbeing workshop, are brilliant, because it gives people that information and that education. I didn't know about this stuff until I did this job. Why would anyone else? But it's all stuff that we all deal with every single day. We've all got thoughts, we've all got feelings, our body responds weirdly to everything. So for a lot of people, they don't necessarily need one-to-one, or they don't need intensive treatment. It might just be about understanding, okay, my body's feeling like this, and maybe it's linked to this thing, and maybe if I do this thing differently, it'll help. So the educational courses, people get so much benefit from them, and not just because of the information, but just being, obviously they're all online at the moment, but just being with other people and kind of going, this isn't just me, I'm not just by myself. And that is massive. It really boosts people's confidence. It really helps you feel like you're not the only one. Actually, there's a whole bunch of people nodding along going, oh yeah, that does make sense. So I cannot sort of stress how great the sort of courses and groups are for people. A lot of people get really oh no, I don't want to be in a room with other people. But for the people who do give it a go, they really find a lot of benefit from it. And I always want to put it out there because people do sometimes dismiss it a little easily.
Why does anyone think that people don't take their mental health as a priority? Very broad question, but that's
just say we haven't got enough time for that one.
I think it's important to open up this conversation, ask these questions. It's good to get an insight from people. Sorry, Paul.
Well, I think one of the reasons is because they've got so much other stuff going on. You know, I've got a job, I've got a mortgage, I've got kids. I've got a missus who's, you know, nagging at me all the time. Sorry to, you know, I run a men's group, so this is where I'm getting this from. I've got all this stuff going on. I haven't got time to do it. And, you know, that's one of the reasons why people don't look after the physical health. You know, I haven't got time to do it. But you probably have. I was a health trainer in the past, and I used to say, how many people watch Coronation Street every day that it's on? That's 1.5 hours a week, I think. You know, don't watch that, do this instead. You know, it's important to look after yourself. And sometimes people do it like Dave said, when it's gone to the extreme.
Yeah.
Or, you know, they might come and think, well, actually, I'm doing okay. But
do you think
that's one of the big reasons is people don't prioritize it.
Do you think that people find it easier to take care of the physical health in regards to the mental health? Because if you've got a list, this is good for your mental health. Obviously, physical exercise this is good for your physical health. Do you think people will find it easier to go towards a physical health side than they would towards a mental health side? Because I know from talking to people that if you start mentioning things like meditation, mindfulness, journal writing, quite often some people will see that as a chore.
Yeah.
And do you think
it's that thing about, you know, I said before, and some people go, oh, I've got mental health. And well, everyone's got it. A lot of people don't think that they've got a mental health thing until they've got a problem. And we do now, but we didn't used to talk about it in those terms either. It's, oh, it's my nerves, and okay, that's it, you know, or something like that. So I think what we're doing as well is, and this is great platform for doing it, is we're changing the conversation. It's okay to talk about your mental health in the same way it is about physical health, and it's okay to do something about it. You're not a failure if you need help. You're human.
I watched this really good video. It was like on YouTube where it's talking about the sort of the mental health continuum, where sometimes people feel like there's a line to cross where you're ill or you're healthy, and actually it's like your physical health. You've got to continuously work on it. You know, so looking at different strategies and trying things out. It's not sometimes people have that when they come to treatment, like there's going to be session 4. I'm gonna have felt better by then, and that's it, and I'll never feel unwell again. And it's something you've got to continually do. So whatever we talk about in our treatment, it's always about, okay, so if we taught you these coping strategies, you've got to keep trying them. They're all little, and they're small changes, but if you stop it, it might feel the same way you did before. So I think people have like this sort of imaginary line that they've got to cross or something in their head.
Dave, do you want to come in? Because I keep ranting.
No, literally just off something that Charlotte just said then is thinking about that continuum, is the idea that you don't actually cure mental health or physical health, really. A physical illness like a cold or whatever, it kind of just cures itself in time, right? So there are cures for those things, but your overall physical health is your physical health for your entire life. It's something we maintain. It's something we look after. And that is the same with mental health. Like the episode of my podcast that went out yesterday is called What is Your Mental Health Diet? And it's not about what you actually consume food-wise. It's about what you consume, like the conversations you consume, the social media feeds that you consume, and all the rest of it. Because I know personally, I totally and utterly fixed my mental health like 7 years ago, and I've never been bad since, is a complete and utter lie. But I know that over the last 6 months or so, I've been consuming less audiobooks because I'm not out the house to consume audiobooks. And what do I do with that extra time? I don't just sit and listen to an audiobook at home. I sit and doom scroll Twitter. And it's like what I'm consuming, which is, it does impact your mind. It does impact how you feel. And there was just something that when Charlotte said it before, is like about it's as okay to talk about your mental health as it is your physical health. I'm going to go one further than that. I think it's actually better to talk about your mental health than your physical health, because even though you do need to do the things that you talk about in both, you actually do get benefit just from talking with mental health. You don't talk about push-ups and get the benefit of them, but you can talk to a counsellor, and you'll get more work by doing more further along by doing the work, but you'll actually get some progress just from having the conversation. You go and talk to a personal trainer and they say, that's the leg press over there, those are squats that person's doing. That's not actually going to make you physically any healthier. But talking to someone about, this is what anxiety is, this is the way our minds work, this is the way that that's going to improve it. So if anything, mental health conversations are way more important than physical health conversations. And I say that as a person who's a qualified personal trainer. So kick me out the industry, take away my license. And,
we just need to take that clip of what you've just said, Dave, and then put that as an advertisement for Minds Matter. That'll draw people in, that, I think.
I can do that. Where are we?
It's brilliant.
I'll clip that.
It's really good you saying that as well, Dave. And the other thing is as well, I just add in that your physical health and your mental health are linked together.
Yeah.
You know, if you've got poor mental health, it'll affect your physical health. If you've got poor physical health, it'll affect your mental health.
Yeah.
It's health. They go together. They're not separate. And the mental health bit, like Dave said, I think he's right. If we bottle it up and try to cope with it on our own when we don't know how to, we'll get worse.
Yeah.
But if we go and talk to someone, we will get better.
And we do so much work now with long-term health conditions. You know, people weren't realizing that actually, if you've got chronic pain or fatigue or something like that, obviously you might feel really down because you're not able to do the things you did before. And, you know, they're also interlinked. So we're doing a lot more work and engage and sort of linking with sort of the physical NHS team as well, to sort of help people manage these conditions, both physically and mentally.
I think what I'd like to come back to, Charlotte, which we mentioned before, is just to touch on some techniques which you'd advise people, and any of the three of you can talk about that. And also, I know, just to go back to what Dave said, Dave did mention his podcast, shameless plug again. We did also do a podcast with Emma, which was last week, was it? Which is available on, how many?
4? 3.
Was it?
Maybe 3 or 4.
Oh, I don't know where time's going.
I know.
That is available on all platforms for podcasts, isn't it, Dave? Just to sort of plug that.
You're plugging it for me now. It's
type in
look up Master the Mind,
the
Master anything on any podcast platform, and you will find it.
I could feel that you wanted to plug that in there, so I thought I'd come back to it. So Charlotte, or any of the three of you, I mentioned that a lot of young people in particular have been having panic attacks over the last 12 months. So if somebody comes to you and they say that they've been having panic attacks, sort of what guidance do you give to them in terms of how can they reduce the symptoms that are coming from it, and what they should do to help themselves?
Well, what I do first of all is just really go into what's happening in your body and educate people on that, because a lot of it comes from this fear of the unknown of, you know, my heart, I'm gonna have a heart attack, or I can't breathe or something. So panic is my favorite subject to go through with people because it's so interesting. And I use all the stuff that I talk about myself, and I found this really helpful, just understanding what your body's doing and why it's doing it. So I won't go into all of that because I'll be here for like half an hour, but we talk about sort of where flight or fight came from, you know, like the evolutionary purpose of it, you know, what that means in today's society. We go through individual sort of I don't like calling them symptoms of panic, because symptoms implies that they're bad things, and actually everything that is going on in your body is proving that it's actually working really well. So I actually call them sort of, you know, I'll go through all the sensations of your body, explain what they mean, why it's happening, and let people, I sort of go away and I sort of say, go away and have a think. Next time you're experiencing that, when your heart's racing, think, oh, it's racing because of these reasons. It's my stomach's going like this because of these reasons, and see if that helps shift your mindset of you know, what you're thinking about and how you're experiencing the panic. Because as Paul was saying, the PWP techniques are all based on CBT principles. So your thoughts, your behavior, and how that's linked to your feelings and your body. So if you're having all these really upsetting, frightening physical sensations in your body, and your instant thought is, I'm going to have a heart attack and die, if you can change how you're thinking about the physical sensations, you might then not feel as scared, you might not feel as panicked, which won't hopefully lead back to more physical sensations. And there's things like sort of breathing exercises to slow down the different nervous systems in your body, because that all that sort of stuff gets really ramped up. You know, your autonomic nervous system really ramps up when you're panicking. So it's all about slowing that down, calming that down, using things like progressive muscle relaxation to unclench everything essentially, because when you're anxious, you tense up instantly. So we talk about all those different things, and then it might be we've got something called graded exposure, where we gradually expose you to the thing you're scared of that might be causing the panic attack. So building up your confidence very, very slowly, so that you're not feeling as scared in that environment, and maybe your body won't respond in that way as much. So that's in a very brief snapshot.
Thing to remember as well is with panic is it's not very nice. It is uncomfortable. It will go away, and it can't kill you.
Yes, that's always the massive message. I can't believe I forgot that one. Yeah, people do feel like I'm going to die. It's going to really hurt me. But it's actually your body's defense mechanism trying to protect you. And if you think that your body's natural defense system is going to make you fall on the floor, have a heart attack and die, it is the most counterproductive thing it could ever do to you, and it will not let that happen. It just feels horrible, and we interpret it as something catastrophic happening to us, when actually it's just we don't understand what's going on, and our body's in its sort of evolutionary past. So we just go through and explain all those different things.
The last question that I'll put to yourselves before we go to the chat, or if Dave's got anything. Obviously, things are returning to some form of normality now, and more people will be returning back into the office. That alone will increase people's anxieties. What are some top tips from you all to just basically reduce people's anxieties when coming back to work? Anyone could start with that.
Stop for a bit.
I thought you were going to say stop work then.
No. Stop work.
I thought flipping, eh?
In a way,
and I'll just get me hat.
Basically, yeah, there we go. Stop work. Stop what you're doing. Breathe. 10 seconds. Look where you are. Calm yourself down, like Charlotte said, and be in the moment. You know, I'm in the office. Okay, I feel a bit anxious, but that's okay. And focus on what you're doing, and the anxiety will go away. Don't focus on the anxiety.
We've actually written some tips that we're going to be sending out for people dealing with this sort of anxiety. And I'm going to go completely blank and forget what was written now, but it was things like Paul was saying, maybe just you can do things like attention training, where you think of 5 things that you can see, 4 things that you can hear, 3 things, so you're using all your senses basically to ground you in that moment, but also just trying to talk to people, because a lot of the time people keep everything to themselves. They feel really isolated with it. And actually there's going to be so many of us who are feeling this way, but trying to take that pressure off and let people in. And also just, I've forgotten what all the other ones are, but we have released a few. Don't know if
it's basically as well is don't fight it. You know, if you're anxious, you're anxious, and that's okay.
Feel it.
And then it will go away. Again, like I said, with panic, anxiety can't kill you. It's not nice, but it can't kill you, and it will go away.
I think above everything really is just remembering to be kind to yourself within all of it. You know, not to beat yourself up for feeling anxious or for feeling concerned about returning to some form of normality, that we're all going to feel that way. And it is a bit strange because we've all been in lockdown for the best part of the year. So just remember that, you know, if you are feeling self-critical, if you are sort of beating yourself up, just remember to be kind to yourself and tell yourself, like Paul said, it's okay. You know, we'll get through this and we'll be all right at the end of it.
Perfect. Thank you for that. Dave, do you want to add anything?
On anxiety?
I feel that you might want to say, I think last time you said about thinking about things positively rather than thinking about what can go wrong.
Don't put me in the toxic positivity. Now think about it, the best case scenario. No one has ever got anxious about the best case scenario. We only ever get anxious about what if it goes wrong. But actually, I want to echo something that Emma's just said then, because we'll be getting, funnily enough, people who I know who already have social anxiety are actually doing better. They've had practice. They've had like 25 years worth of practice of being anxious around social situations. The people who are struggling the most that I've come into contact with recently are ones that have never experienced anxiety before. So they go into that lovely question, which we have banned, which is, what's wrong with me? There's nothing wrong with you. You've been taken out of your environment and your comfort zone has shrunk, or maybe not shrunk, readjusted to a home working environment for the last year. So which doesn't currently encompass being back in the office. So it's normal. It's perfectly normal that, like, if you were told, let's say as in the middle of school, you were told that you can't socialize for a year, you'd understand that after going back, that actually socializing is a little bit harder. Being around people is going to be a little bit harder, even for people who've never had contamination anxiety or health anxiety, even for people who've never had social anxiety before. And for those people, it's actually going to be a bit of a shock, because you're probably feeling these feelings for the first time. So in a weird way, COVID's leveled the playing field for us people with mental health, but that's okay. That's okay. Just know that actually by doing it, by exposing yourself to that, and then at the end of the day, it might seem really silly, but giving yourself a pat on the back for getting through your first day at work. Not joking. Like, seriously, expose yourself to that first day at work. Go in, do it. Even if it's hard, at the end of the day, be like, yes, I got through that. And actually what you'll start doing is that comfort zone will readjust. It's just, it had to do that once upon a time when you first started working, but you didn't have any frame of reference back then, but now you have. Well, I was working fine a year ago. What's wrong with me now? It's like, you've just been through a life-changing pandemic. There's nothing wrong with you. So that's all I'd say on it, really.
I do, again, Dave, I do that at the end of every week. I go, well done me, I got to the end of the week again.
At the end of every minute, if you need to.
Well, yeah, exactly. But again,
I'm like this every minute, mate, in work. Yeah. Everyone's looking in the office.
We're all amazing. We need to just remember that.
I think people are so self-critical. I think that's one of the biggest sort of unhelpful thinking styles that people do. They're so self-critical, and complimenting yourself is so alien, especially as like the British public. We're not very good at taking compliments and bigging ourselves up and things like that. So, as a society, we're just not good at it, and we need to learn to talk to ourselves differently. And it is a skill to learn, and it takes a bit of time. So I definitely echo what you're saying.
I agree. And you're all amazing. I might as well just chuck a nice compliment out there just to ensure that you hopefully take it all on board.
Sam.
Dave, is there any questions left to be answered in the chat?
Are you finding there is more demand on your services due to COVID, especially from underrepresented groups like BAME who have been adversely affected?
Sorry, what was that last bit? Sorry.
Are there any extra demand on your services due to COVID, especially from underrepresented groups like BAME who have been adversely affected?
Well, we're starting the coping with lockdown course, specifically looking at struggles during lockdown, the sort of problems that everyone's faced because of the pandemic. But we're trying to. We've all got champion roles within all the different teams where we're trying to reach harder to reach groups. We've got sort of the BME champions, and we're actually developing podcasts to go on our website so we can be reaching out people in different languages. We've got things like the young people's champions, we've got the perinatal champions, we've got older adults champions. So all these different groups are trying to go out and sort of raise awareness of our service, what support is available, know that they can come to us and self-refer. And I think having everything online during COVID has made some of that a lot easier. Sometimes it can be a lot harder, but it has meant that there's different platforms to do that. And we might not have thought of putting podcasts on websites and before now.
Awesome. Someone said they've just had a look at Silvercloud, which I think one of you mentioned earlier. How is that accessed?
So it's all via email. So once you have your telephone assessment, we'd get your email address, and then we'd send you a link to your email. And it's a service that you register and create a profile, and you sort of go through the different programs with all the different coping strategies, a tailored program for that individual. And then you'd have like a review every couple of weeks with a clinician. So it's a lot more sort of independent, and you can do it completely whenever suits that person, if they work nights or they can't do during the day. So they access it online at home.
I think the thing with that as well is I don't think Silvercloud is everywhere. I know we use it within Minds Matter, and to get on Silvercloud through Minds Matter, you would ring us up, refer in to Minds Matter.
Yeah, and for anyone who's listening who's from outside of Lancashire as well, if you look up IAPT services, because obviously we mentioned earlier they do have different names throughout the country. For anyone outside of the country, soz. But there is, what's the one we usually use for that? I'll forget it. But we've got a resource that we use for anyone outside of the country.
Help us to help you one, is it that one?
No, it's checkpoint.org. There we go, checkpoint.org. which apparently a lot of the UK ones link to Australian services, but that's okay because we've given direct UK services. So there is just one more question, which is, it says, my niece benefited so much from graded exposure for her panic attacks. Any signposting resources for this or anything else that you can share?
One of the things I use quite a lot, the Centre for Clinical Interventions, CCI. It's an Australian website, which just made me think of it, what you said there, Dave. But it's got a lot of workbooks. It's got a lot of information sheets on there, and a lot. It's all evidence-based from around the world, and it's a really good resource. And there's another website, Get Self-Help, which has got stuff on there as well, and we use these in our therapy because they're well written and well presented. So anyone have a look at those.
Perfect. Anything else, Dave?
No, that's everything from
chat. Perfect. I guess we'll round it up. Thank you very much, everyone, for joining us today. Really appreciate it. Really appreciate all your insights to Minds Matter. I thought it was absolutely fantastic. So, as I said, if anyone does want to email me any questions or comments after this webinar, then email me on sam.tyrer, Tyrer, at lscft.nhs.uk. Is there anything else you'd like to say before we end the live stream?
I would just say, if you are struggling, self-refer and give it a go. Have a chat at a telephone assessment. We can decide together if you want some support with us through another service, but have that conversation if it's been playing on your mind.
And talk about your mental health.
Emma, do you want to say anything?
Just be kind to yourself.
Perfect. Right. Thank you very much, everyone, for watching, and we'll be back next week at... Dave, I think it's 10 o'clock on Thursday.
The normal time.
Yes, 10 o'clock on Thursday.
10 o'clock on
and
Thursday.
Next week's episode will be focused on alcohol and recovery. So I look forward to seeing you next week at 10 o'clock on the Thursday. Once again, thank you for tuning in. Enjoy the rest of your afternoon.
Thank you, everyone.
Thank you.
Thank you, everybody.
One.